Hey everyone, this video is going to discuss delirium, specifically hospital-associated delirium, so let's get straight into it. So what exactly is delirium? This is generally defined as acute changes in consciousness and cognition that involves confusion. Generally, delirium develops rapidly over a short period of time. If you spent any time in a hospital, you've probably come to recognize how common delirium is. It affects 10 to 30% of hospitalized patients. What's really important and why I think it's essential for us to know this information is that 40% of cases are actually preventable. So there are things that we can do while practicing in the hospital to really help these patients avoid this change in consciousness and ensure that they're receiving the best care possible. When it comes to diagnosing delirium, the very first step to take part in is to consider and investigate the common causes of delirium. And you see on the right side of the slide, there's a really good mnemonic that I use and I recommend that you use. It's a bit dark, but it says I watch death. So this stands for infection, withdrawal, acute metabolic or substance abuse, trauma, CNS pathology, hypoxia, deficiencies, endocrine, acute vascular, toxins, and heavy metals. So these are just things you want to keep in mind when you're taking care of a patient who maybe you are suspecting of delirium. You want to keep these differentials for the cause of in mind. And generally, some of the main causes of delirium include UTI, medication changes, and substance abuse. So you definitely want to keep these in mind when you are taking care of a patient who you've noticed is acting strange or seems confused. Here is a good list of medications that cause delirium, and this is by no means final. There's a lot of medications that can cause this, but these include benzos, antihistamines, tricyclic antidepressants, dopamine agonists, carbidopa, levodopa, anticholinergics. There's a lot more, and you also want to be mindful for drug-drug interactions. Like I was saying on the previous slide, changes in a patient's medications, especially when they first come to the hospital, can play a really drastic role in them developing delirium. Oftentimes, a simple change can really have a dramatic effect on how they're doing cognitively. When it comes to management of delirium, there's both non-pharmacologic and pharmacological interventions. So let's start off by talking about non-pharmacological interventions. And these are very simple steps you can take to really make sure that your patient does well over their hospitalized stay. So this involves putting a clock or a calendar in their room, giving them a schedule, encouraging normal sleep-wake cycles. A key way to do this is making sure the blinds are open in the room during the day. It's super common to walk into a room at like 2, 3 o'clock in the afternoon and see a patient's room like completely shrouded in darkness. This is going to play a major role on affecting their sleep-wake cycles, and it's really going to make them confused. So encouraging normal sleep-wake cycles is very important. If a patient just had surgery, you want to make sure you're mobilizing them as early as possible, within reason, of course. You want to address any hearing or vision impairment because this can contribute to their confusion. And then you don't want to put them in the same room as another delirious patient. Now, in regards to pharmacologic interventions, you do not want to make antipsychotic medications the standard treatment for delirium. You want to reserve these medications for patients who are aggressive or are in like extreme distress. When you do decide that these medications are necessary, then you could use haloperidol, risperidone, or olanzapine. They're generally as effective as one another. But keep in mind, you want to give these medications at the lowest dose possible for the shortest duration. You want to control the episode and bring the patient back to where you need them, but you do not want to make them dependent, especially on older and confused patients. These medications are not a good idea to make the standard of treatment. Thank you for watching. If you have any questions about the information in this video or about anything else, please feel free to leave them below and I'm happy to answer them. Thank you.